At the end of the day, a front office staff member, I don't think should be what separates, you getting your best result and improving your future. You should select it based upon the technical ability, the skills, the demonstrated outcomes of the plastic surgeon. But sometimes patients will go to another plastic surgeon simply because they feel as though the customer service was not up to par. So as a result, whenever I encounter something like that with my staff, my first order of business is to go to the staff person and ask them what was their interpretation of the events that occurred. And if I find that, the patient was being unreasonable, which, is definitely a significant portion of the time, then I think it's probably better not to operate on that individual or have them around in the plastic surgery offices, because that can be a very toxic environment. If they're bad before the surgery, if they're disrespectful, then it won't be better after the surgery. So, of course, you're going to lose some business of that. However, if I find that the customer service was lacking due to some either lack of knowledge, or perhaps somebody was having a bad day or was particularly shorter, or maybe didn't know the information to provide the patient, we go over that. We strive to improve all of those aspects. So don't think that I think that that is unimportant. I think that's very important. It's just that I am not in direct control of that. Certainly I supervise it, but at the end of the day, I'm supremely focused on surgical results, patient safety in the OR, post-operative instructions, preoperative instructions. And that is so the patient can get the best possible outcome. So make no mistake, those things can occupy all of my time, to be sure. And I think that patients need to realize that sometimes I'm answering hundreds of emails a day. Now, I'm fairly fast at typing, and my brain works fairly quickly, so I'm able to, have a huge output there, even though I'm maybe in the OR 12 hours a day. However, it is difficult sometimes to keep up with some of these requests that the patient has, so just be aware that sometimes I do have other commitments and I can't get back to an email that the same hour that you send it. So now moving on with this, the patient kind of describes her day of surgery. She says, the day of my surgery, I was pretty nervous, but everyone there from the receptionist to the nurses made me feel extremely comfortable and calm my nerves. And yes, patients are extremely nervous, especially a person who maybe has not had surgery before or who hasn't had cosmetic surgery. You can guarantee that they're nervous, okay? So, be aware of that and I think that knowledge and information is very critical to improving that feeling. And I think the more that the patient knows to an extent, the better off that patient will be as far as handling the surgery.